If somebody is already suffering from a kidney disease, there are few things that you need to be very vigilant about. As far as the lifestyle modifications are concerned, the first and foremost would be an abstinence from smoking completely and to a large extent from alcohol. These are the two important things when it comes to lifestyle modification. The other important one is to have an active lifestyle, in the sense try to do some moderate aerobic exercises for at least 30 minutes 5 times in a week. If your renal function is, if your kidney disease is not very severe, like if you are in the first and second stages of kidney disease. But if you are in the later stages of kidney disease, physical activity may not be possible for you. It may cause breathing difficulty, and also always check with your doctor if you can do your physical activity. The other important thing is to avoid over-the-counter painkillers. If you have any pain or anything, always better to consult your doctor, get yourself examined, to look for the cause of the pain, and then he would be the best person to advise, because over-the-counter painkillers may worsen your renal function much more rapidly, and it may push you towards dialysis much more earlier. The other important thing is the dietary modifications. Protein as little as possible is number one. Number two is salt as little as possible. The maximum amount of salt that you can have in a day is around 4 to 5 grams. An average Indian diet would comprise somewhere around 10 to 15 grams of salt. So to give you roughly, you should cut it down to 1/3 of what the normal family is using. Another one is to cut down on foods which have very high potassium content. So avoid fruits, avoid fruit juices, don't take coconut water, and you have to practice leaching when you are using vegetables. That is, you have to cut the vegetables, soak them in water for 10 to 15 minutes before you cook them and use. And if you follow these things, most of the times your kidney will work for a very long period. The need for dialysis which will come much later in your life.